We have a really busy show for you here today, so we're going to get right to it. We have the Chief Peacekeeper, Dwayne Zacharie, Maris Jacobs from PlanIT Consulting, Robin Delarone, the Executive Director of the Kahnawà Education Centre, Lisa Westaway, for the Executive Director of Kmhc, and Lloyd Phillips, Commissioner of Public Safety. And we'll start off our show with the Chief Peacekeeper, Mr. Dwayne Zacharie. Dwayne.
Good afternoon, everyone. I wanted to come on the show today to give everyone an update about the new border issues or new border criteria for people who will be crossing the border or people who are thinking about trying to cross the border. It's pretty intricate. There's a lot of information. So what I want to say is that if you have questions, of course, I'm always available. Contact me at my office and we'll go over your scenario and I'll let you know how it applies or doesn't apply to you. But for now, I just wanted to give an update to everyone, so I'll get into it. All right. So beginning this Monday, yesterday, there were new travel criteria. Some people now have exemptions to cross the border. Some people still don't have an exemption. What that means is some people are not required to have a test, and some people are. And most people will still require to have a test. And what that means is, here in Ganwage, we always analyze it at the task force level, and the task force is responsible for all of the directives within the community of Ganwage. And just because Canada or Quebec does something doesn't mean that it'll necessarily translate here, okay? So this is an update. These are requirements for people crossing the border. That's to cross between Canada and the United States. It doesn't necessarily have an impact here in Ganwage. So I want to make sure that people are clear with that, all right? Because we'll still have directives here, and the directives that we have in the territory in Ganwage are in place for people to be safe and secure, right? And there are a number of different issues why we have these directives. Some of them are in relation to like population density, that type of thing. So here, if we have a lot of people doing a particular type of work or trade or activity, right, it affects the community much more because we're a close-knit community, whereas somewhere else, like with bigger populations, like Montreal or Chateauguay or something like that, it may not affect them as much. And here, you know, one person who is affected by coronavirus can then affect a lot of other people. So we want to make sure that we can mitigate those issues as much as possible. So that's why we would have different directives than another jurisdiction, okay? So I'll get into some of the exemptions. So right now, what's happening is iron workers. Iron workers are exempt from having a test to cross the border to come back home, okay? And what that means is when you get to the border, you'll be able to cross without showing a negative coronavirus test. There are some other criteria for you. Iron workers must prove that they are employed, okay? So what they're going to require when you get to the border is they need lots of information. And the more information you have, the better. Because what you need to do is you need to convince the border agent that you are exempt. Right? It's not about who you are or what your background is or what your race is. It's nothing to do with that. It's got everything to do with mitigating the effects of coronavirus. So what they're going to need is they're going to need a pay stub. If you have a work contract, if you have a bunch of pay stubs, essentially the more information you have that proves that you are gainfully employed in the United States, it's going to help you out a lot. You know, if you show up at the border and you have a pay stub from 3 years ago and that's all you have, it's probably not going to help you very much, right? So you need to have current stuff. The more recent your information is, the much better off you'll be, okay? I also wanted to highlight too, in certain situations, I know I've had contact with some of the unions in the States, and I know that some of the iron workers are testing all the time, like on a weekly basis. They're having a PCR test, and from my knowledge about the testing, the PCR test is the most accurate one, and that's the one that we're actually using here in our community as well. It works really well to detect the presence of coronavirus, right? That's my understanding of it. And for our purposes here in Ganwage, more than likely, your question is always, well, if I come back to Kahnawake, do I have to isolate? Okay, so what we tell people is, whenever you're traveling, you know, our first thing is to say, don't travel. Don't go out of the community as much as possible, stay local. But if you must travel and you are in the situation where you're a cross-border worker, you know, trade, transport, any one of those areas, and you have to do it, and I understand that people have to make a living, so it's not an issue. We want to make sure as much as possible that people, when they come back to the community, are safe. So for those people who can prove that they've had negative tests and for a long period of time, those negative tests, for our purposes, from a Peacekeeper perspective, would be acceptable to say that you don't need to isolate. Anyone else who does not have tests, who can't prove it, you know, who has a test called rapid test, those are not acceptable. We don't accept those. You must isolate, okay? So that means when you're coming back home, you must isolate. That's for the safety and security for our community. We're asking people to be responsible about it. So we're hoping that people will comply with us. As I've said before on other occasions when I've been here on Facebook Live updates, I've asked people to cooperate with us and help us to do this, because it's not just about the task force, it's not just about the peacekeepers or individuals, it's about everyone, and everybody needs to be responsible. Lots of people call me on a weekly basis and say, hey, is it okay if I go, I'm just going to Champlain, I'm just going to pick up my mail. So you're not exempt. If you cross the border to go and get your mail, you're not exempt. When you get to the border, you're going to have to prove that you have a negative coronavirus test. And from what I understand, the border is going to require you to get a test. You'll have to go somewhere. I don't know where all the testing facilities are. Wherever you're crossing, you'll have to do that, and there's a cost associated to that. In the States, they don't give them for free, so you'll have to understand that. At the same time, once you cross back into Canada, they're going to require that you isolate. We already require it too. So you'll have to do that. And now they're having a few more strict criteria put on people, right? So you're going to have that negative test. They're going to get some kind of contact information from you, whether it's an email or a telephone number, and they're going to be checking on you much more than they did before. This is, again, more extra measures put in place to try and curb the effect of coronavirus. Now, if you have to cross the border to go and pick up medication, prescriptions, that type of thing, then you are exempt from having to test. When you get to the border, what you need to do is you need to show to the agent at the kiosk that you pull up to, you have to prove to him or her that you are a person that needs to cross the border in order to pick up, you know, medication, or even to have medical procedures done, or to see your doctor. So you're going to need a letter from your doctor. You're going to need to provide proof of your prescription, that kind of thing. And then you'll be exempt, and then you won't have to worry about testing. And if you're just going for the purposes of picking up your prescription, then the isolation thing will have to be reviewed on a case-by-case basis. What the border has told me, and I've had numerous conversations with Canada Border Service Agency, they're saying that you are considered exempt for a number of different reasons, and you can go on their website, you can go on the Canada COVID website, and on there it'll tell you what the exemptions are. But what you have to understand is you're only allowed to do what you're exempt for. So if you're going away to work, then you have to go away to work. It's not to go away and go on vacation. It's not to go away and like go grocery shopping and those types of things. You're only allowed to go for whatever your exemption is. So if it's to go and cross the border to get your medication, that's all you're allowed to do. You're not allowed to say, oh, well, I went get medication and then I went to the grocery store and I went pick up a bunch of, you can't do that, because then you'll lose your exemption and then you'll have to find another way to get it done. These, again, are measures put in place to ensure that people comply and to curb the effects of coronavirus. Throughout this entire time, and since people started talking about the new measures that may be in effect, I've had a conversation with different police services, as well as I said before, the Border Service Agency. So they want to work with us as much as possible. They understand the situation with Kahnawà. They understand the situation with First Nation communities. But at the same time, they're trying to fight against the pandemic too. So what they're asking is, when you show up at the border, work with them. They want to make it as quick as possible. They want to make it as painless as possible, but they need your cooperation too. And remember that the agents at the border, they're not stopping you. It's not a rights issue. It's a pandemic fighting issue. So that's what they want to do. So that's what they're going to be asking about. So answer their questions and try to get through it as soon as possible. And remember, the more information that you can provide to the agent, that will help he or she to determine, that you are exempt or not, and it'll go a lot quicker from there. Right now, the exemptions talk about cross-border. So if you're a cross-border worker, if you're going into the United States to do your job, right, you're only allowed to go there to do your job, and then you have to come right back home, obviously. So when you get to the border, they would say that you're exempt and do not need to have a test, okay? But remember, when you come back to Kahnawà, whatever you do affects everyone here, so you have to be responsible, and I would recommend that you stay current with the COVID-19 task force directives to make sure that you're complying. And as I said at the beginning of my my time on here today, if you have any questions or about your particular situation, please, by all means, contact me. I'll help you. We'll talk through it, and we'll figure out the proper rules for you to follow and the scenario that you should be following for you, because it's impossible for me to come on here and talk about every single scenario under the sun, because there are a lot of different scenarios, and the information I have tries to capture as much as possible of that. But I mean, no two people are doing the same thing, and lots of people have different scenarios that they're in. At the base of it all of these measures are put in place to counteract the effects of coronavirus and to mitigate it, so that way we can get out of the pandemic as soon as possible, right, and try to go back to some type of normal life like we had before. So I'll continue on. Child custody agreements. So people who are in a child custody situation are allowed to cross the border, but what they're asking you to do is to ensure that people in the vehicle are wearing masks, right? If you can't do it and someone else is doing it for you, make sure they also follow the rules. You wouldn't want somebody to lose the exemption for you because they didn't want to follow the rules. They're asking for people to wear masks, and they're asking that if you must get out of your vehicle, it's only to escort the child to and from the vehicle, like from the front door, that kind of thing. They're asking you not to go in homes. They're asking you not to go and stop off at a convenience store or stop at, and say, oh, I got to pick up groceries first. It's to do exactly what it is that you told the border you're going to do. You're going there to pick up, a child or pick up or drop off. That's all you're allowed to do. Cross-border students, same thing. Right? There's an exemption for you to go back and forth, but again, you must prove that you're a student. You need all your current information. They're not going to take a report card or a letter from an educational institution from 2 or 3 years ago. It has to be current, right? So you have to, every time you cross, you'll have to prove that you should be a person who has this exemption and is entitled to it. All of the other prior exemptions are to essential service providers, emergency services, essential medical, those types of things. One thing I want people to understand is that as much as possible here with the Peacekeepers and at the task force, we're going to try and help you. We're going to try and help you navigate these waters as best as we can, but we're also asking that you cooperate with us and help us to make all of these measures, as seamless as possible, because I mean, for one thing, we wouldn't want people to start losing their exemptions. We want people to understand, right, that these are in place to try and stop the spread of the virus as much as possible. The directives that we have here in place in Kahnawà, as I mentioned earlier, are to try and fight the coronavirus, right? And because our population is the way it is, and we're much different than other communities, and I don't think there's anybody that would argue the point that Kahnawake is different than other places. So because we're different, we need to have different measures in place. I know Canada is doing something, Quebec is doing something else. It doesn't matter. What we do here in Kahnawake is to safeguard the community of Kahnawake and to make sure that people are safe and secure as much as possible. I don't know if you know this or if you follow up on some of these stats, but in some of the communications that I've had with other First Nation communities and other chiefs of police across the country, is that they're really impressed with the work that Kahnawake has done, you know, as a whole, because with our population and the size of Kahnawake and the number of cases that we've had, you know, it's low in comparison. Like some communities who are half our size, or even, you know, like just a quarter of our size, have hundreds of cases that are active at one particular time, you know, which is very high in comparison to Kahnawake, even at its height and at the peak of when it had a number of active cases. So all of that is because of the directives that are in place, and obviously because of the cooperation of community members here in Kahnawake, right? So all of that, we can't do this by ourselves. And I appreciate all of the work and responsibilities that people have taken to try and do this and make Kahnawake a safer place. And, you know, things are starting to change, and we're hoping that some of the directives that we have in place, you know, can one day soon hopefully be relaxed. But until that time, we need people to follow all the rules. We need people to do what it is that's right and be responsible. Obviously, you have to do the distancing, the masking, the hygiene, you know, and the new thing that we're talking about is be aware of how you're feeling about things. And, you know, like mental health is a huge issue here in our community, and we want to make sure that people are taking care of themselves too. So, you know, if you need help and you want to contact the Peacekeepers, we'll try and help you there. You also have KSCS, right? They're out there trying to help people. So be aware of it. And before I sign off, I wanted to make sure that people understood what I said. And if you didn't, that's okay, because I said quite a bit, and I said it quite quickly. By all means, contact me. We'll talk about your scenario. We'll work through it. We'll try to figure out the safest way for you to go about your business. And just remember, next week there'll be new border measures put in place, right? So the only thing that I didn't talk about, and I should mention before I get off, one last thing. Anyone who's crossing the border for their own personal means, meaning recreation, travel for vacation, just to go and get groceries, check the mail, whatever, you're going to be required to have a test when you come back and try to enter Canada. It's the rules, it's the way it is, you'll be the one that's responsible for footing the bill, you know, paying the cost. So make sure that you're aware of that, make sure that you know. Next week, the border says that some of the measures in place will be when you're crossing back into Canada, they'll be doing the tests right there at the border, from what I understand. Right? So you'll have to have the test, they'll send you home, you'll have to self-isolate for the 14 days, and during that time, they're going to make you do a second test just before you come off of isolation. So they want to make sure that people are following the rules this time. They're putting in a bunch of different measures. So I hope that was informative. If you need anything else, by all means, contact me, and I'll help you out. Now,
Yeah, Dwayne, appreciate all the information. Up next is Maris Jacobs from PlanIT Consulting. Maris?
So, good everybody, my name is Maris Jacobs. I'm a consultant with PlanIT Consulting and Communications. The last time I was here, we were just about to begin the Kahnawake COVID-19 Business Impact Survey. And we're starting now the second part to this whole project, which is to distribute or to use some of the results from the survey. So the results from that survey were used to develop 5 new programs which are intended to financially assist businesses that have been impacted by the pandemic. So $1 million from the Indigenous Community Business Fund will be distributed through these new programs that have been created. I won't go into detail about each and every one of them for the sake of time, but also because that the application is one application process and one form to make it easier for businesses. So during the application review phase, which is going to be conducted by Dwayne, you will be sorted into the appropriate program based on your needs. So basically all that businesses have to do in their application, to summarize, is give an idea about what they need, what they're requesting, why they're requesting it, what the funds are going to be used for, and then also provide some supporting documents that is going to support their request. The majority of the programs, so 4 out of the 5, you can receive up to $10,000. And you can apply for more than that, but the maximum that each business can receive is $10,000. There's an additional program, the Growth Opportunity Program, where you can receive up to $25,000, but that's specifically for investment programming. So our job at PlanIT is to reach out to the business community and inform people about what's available to them, as well as assisting with the application process and how to access it and how to submit it. So for the next month, our team is going to be doing outreach as well as processing the applications. So you can probably, if you're a business, you can expect a call from one of our team members to reach out to you about those different programs. The deadline to apply is March 15th at 4 p.m. So there's just about a month for this first phase of funding. But we strongly encourage businesses to apply early. This is to avoid having any confusion with your documents. If there's something missing, we can address that early on. And some of the things that the programs are going to cover include but aren't limited to things like rent, hydro costs, internet, phone, paying for training, hiring consultants, basic operating costs, and more. And those things are all going to be obviously sorted after in the review process. Some of the supporting documents that you might have to supply include financial statements, invoices, quotes, business plans. And again, we can work that out with you over a phone call or email. And as always, you can reach out to us if before we contact you. And you can get a hold of us at info@planitganawake.ca, or you can reach me at 514-971-8077. There's also going to be paper copies available at the Dowdenizakta lobby, so that's just next to the post office, and you can mail them in if you'd prefer to do that by paper to P.O. Box 222. And all online applications should be submitted to info@planitganawake.ca. So we just want to encourage every business to look into it and apply. Even if you've never applied for any kind of funding before, it's a really good opportunity to get a one-time grant. If you've applied to the Business Interruption Fund before, you are still eligible to apply to this one. You just can't apply for the same item again. So if you have any questions at all, reach out to us, again, at info@planitganawake.ca, or you can reach me at 514-971-8077. But I have to drive home first, so wait till I get there. So, Nyawa.
Yawa Maris, don't forget, give her a little bit of time to get home. We'll be done in about 25 minutes. Up next, we have Robin Delarone, Executive Director of the Ganawage Education Center. Robin?
It's been a while since I've been here, so today what I want to do is bring the community up to date in terms of some of the activities and things that have been planned for the Education Center for all of our 3 schools within the community, looking at current and past the March break. So first of all, just to bring everybody into a place in terms of where we're at right now, we are now, all our 3 schools going to be finalizing the first term, so community and parents will be expecting to receive contacts and information about their students, their children's progress. So we are, normally it would have been a circumstance where we would have been seeing second term progress reports, but due to COVID, we are looking at this being the first term marks. I want to encourage parents. We normally do have a very good success rate of parents showing up and meeting with teachers, and really encourage you to make sure that you do that once again. Communication is important, and you will be receiving information about your scheduled times to meet with your teachers, the teachers of your children. In consultation with the schools, and I want to first address primarily the high school, meeting with the administrators of the school and the teachers. With COVID, we've seen so many different, things that we needed to adapt to. And the teachers and the administration obviously have been seeing some of the impacts of not being able to have the students on site as consistently or at all in some circumstances. And for some, it's been a challenge. And we do recognize that as a school system and as the teachers and the educators within the school, to say that there are many different types of interventions being planned. I think, like, if you look, for example, last week, it was a very nice, touching event to see the teachers at Survival School make a parade around the community, encouraging the students, don't give up, keep going, we're here for you, and outreach in any way that they could. So really congratulate the teachers, but really want to remind parents that we need you too. We need you to be there behind your child. We need you to make sure that, if you need to, don't wait for teachers to make calls. It's important that you can reach out to any one of the teachers or school admin to know how your child is doing. So that's generally the update, and the same with the elementary. They're going to be also entering into finalizing the first term and looking to see, in what ways can we address some challenges that families are facing. It does remain challenging for all our schools to be able to bring students back, all students back in. You're well aware that we are in the red phase, and that it is continues to be a challenge, but we do monitor. We do monitor situations and are looking at alternative plans moving forward. The second item that I want to address at this time is one of the things, as with report cards, we're all quite aware, is that when we finalize the report card period coming up in February, we all know that that leads us to March break. And in normal circumstances, we would be planning a lot of, for many people, travel, going places, just enjoying some time off. But with COVID, I really and strongly encourage families to not travel. Strongly encourage you to find that place within the community, within your home, with your family, to be together, take some time, and just to enjoy one another, or enjoy, activities that you can do together within the community. We continue to want to make our schools a safe place. We want to have everyone return back to make sure that we're all healthy, and that we've done, a lot to prevent the spread of COVID. So I strongly encourage you to make sure that, you find other ways to enjoy this March break that's coming up that aren't travel related. Other things that we're going to be doing and looking forward to and anticipating is, for the month of March, the vaccines and the vaccination. Our teachers, obviously, like everyone else, we all know we all have a choice, but we are really encouraging and promoting that as much as possible, everyone take that opportunity to be vaccinated. But what does this mean for our schools? We've heard parents, we've had people ask, does it mean that immediately after we receive vaccinations that we're opening our doors back to everyone? We don't have all the answers right now, and we will be working with the task force, with local public health. We will be looking at what this means. What does it mean to our schools? What does it mean after that? How will we be accommodating as we gradually go on months later? We do understand we have to continue on with the masking, all our protocols and our guidelines in place, and that will continue up until the end of the year. But we will be monitoring, gradually what does our year end look like. The other area that we're in discussions with and consulting with our administrators of our 3 schools is the calendar. We're currently looking at our calendar for the remainder of the year after the March break. We do know that we will have some minor amendments to the remainder of the calendar, but nothing drastic. So we want to get that information out to our educators first in all our 3 schools, as well as our parents, and then be able to release something to the community, which probably will be possibly by the end of the week, if not Monday, about the school calendar. Some other news that we want to celebrate is that we have, like everyone else, we've been having, or some of our students, most particularly post-secondary students, have been reaching out and said, you know, connectivity has been an issue with online learning. And regardless of what they've tried and so forth, it's been a challenge for them. So we are very happy to say that we have set up for post-secondary students a remote learning center, which is currently located at the Cattery Hall. It is set up to ensure that all safety guidelines are being followed, protocols. Someone will be there to monitor. But the final stages of opening are really dependent. We're waiting on some students to provide us with more details regarding the schedules and the most appropriate times to open up. But we will be getting more information out to everyone for post-secondary students so that they can easily access their courses without interruptions. So to finalize, I just want to make sure that I've you know, addressed everything. But to finalize, I just want to, you know, say that we've got to the point for the March break. Report cards. We have much to look forward to after March. And my main message is to parents, whether you have a teenager or a little one, please keep encouraging them. Please keep monitoring them and making sure that you have contact, that you are supporting them. We know it's a challenge, but please don't give up. We're all here for you. You have your school administrators, counselors, people there. And I wish everyone the best. I wish you, you know, safe March break. I wish you good times with family and a time just to disconnect. So, Kahnawà, and have a good day.
Kahnawà for the update, Robin. Up next, Lisa Westaway, and she, of course, is the Executive Director of the KMHC. Lisa?
Thank you. I have a few updates to provide to you today. So I first want to start with variants. So as you've been hearing in the news, there are 3 variants that are concerning right now that we're hearing about quite frequently. So it's just a reminder to all of you that distance, hygiene, and masking protects you from these variants. We still don't have 100% confirmation that they are more transmissible or that they are more deadly, but we do know that we can protect ourselves by maintaining the measures that we have currently in place. So we really urge you to continue to do that because we do have a risk of variants in Quebec right now. So Quebec, up till now, has documented 13 cases of people who are COVID positive with one of these 3 variants. Up until now, though, Quebec has not been testing all of the positive results to see if these results are a result of a variant or not. They've tested about 8% of positive results. As of the end of this week, 100% of positive results will be tested for the COVID variants, and therefore we should have a better picture of what's happening in Quebec. What we do know is that the Moderna vaccine and the Pfizer vaccine are protecting people against these variants. We don't have all the information on other vaccines yet that are waiting to be approved. I want to also talk about vaccinations. So we do have a little bit of information. As you know, there are delays in deliveries, although by the end of this week we expect to have more deliveries to Quebec and across Canada, actually. And so we should have more information as of tomorrow about possible dates. What we do know, though, is that we still expect to vaccinate 16 and up or 18 and up, depending on the vaccine that we receive, by the end of March, by March 31st. And it's looking more like March is when we'll be getting vaccines for the community. What we also know is that Quebec has released a new schedule about second doses. So we don't have exact dates, but we do expect to be able to vaccinate our residents, so at Kmhc Inpatient, T-Bell, and ILC in the early weeks of March. We also can expect to vaccinate with the second dose our health and social service workers who have already received a first dose somewhere closer to the end of March. So this is very general information, but we thought it would be important to communicate, at least so you know that these elements are being worked on still, even though we're not hearing much about vaccines at the present time. Just a little update on a step-by-step. So I wanted to announce that as of the end of the day today, there will no longer be any children or educators in isolation. So that's really good news. There were no additional cases to identify from the original outbreak that we communicated to you a couple of weeks ago. So everyone has done a really, really good job, great job in fact, of containing the virus from this outbreak, as was the case in the outbreaks that we've had prior at other institutions. Just a notice also that a lot of updates, retraining, education, as is normal and as we do in all outbreaks, has been completed or is still ongoing at step by step. So everyone is participating and everyone is really positive in moving forward from this. Although it's always a setback and scary when this happens, everyone has handled it really well and is moving forward. So really congratulations to everyone in that sense. Kmhc Inpatient, I wanted to address this because there have been some rumors floating around that there has been or there is an outbreak at Kmhc, and I wanted to confirm for all families especially that this is not true. This is a rumor, this is not the case. Just to clarify, all employees of Kmhc Inpatient, Elders Lodge, ILC are screened on a weekly basis. The reason why we screen is to be able to identify cases in the early stages if we need to, so that we can isolate employees before they have a chance to transmit the virus to others. And this is what we've been doing since before Christmas, and we have identified weak positives or positive cases, whether it be at ILC, T-Bell, or Kmhc Inpatient, through these screening processes. This is the reason why we screen. It's the reason why we continue to screen, and it has allowed us to identify cases, isolate when required, and ensure that there is no transmission. So there is no outbreak at Kmhc Inpatient. I just want to make that clear. Testing site. So there is a change at the testing site that the community needs to be aware of. In fact, this is a change that's happening throughout Quebec. There is a project, a new software that's been implemented at all the testing sites across Quebec, which allows results to be sent to the person by email. These results are password protected, so it's only is the individual that had the test that will receive a code that will be able to open the email with the results, so it is confidential. And that is happening as of this week. So when you call to book your appointment, we will ask you for your email address. We will also ask you for your cell number. For those of you who are worried that the email will go to your junk box, you'll receive a text telling you that an email has been sent to you with your test result. Remember, when you have a test done, the Chateauguay lab initially calls and gives you a result, and then if you're positive, the local public health team, so at KMHC, we call you then and we go through contact tracing with you. So you now will no longer receive a call from the Chateauguay lab giving you a result. You will receive your result by email. For those people who don't have an email, you will continue to receive a phone call from the lab. From the lab. 2 weeks ago, we had a report from the Delarone Health Department that there was a case in the Delarone area. This is a Presently, we have 0 active cases in the community. This is really positive. It's great news. It means that from the holiday time, everyone has been working really hard in containing the virus and following the measures in ensuring that we protect those around us. So congratulations, that's great news. We have 0 active cases of those people who have been tested. So we just want to remind you that we don't have a huge amount of people coming in for testing. And we urge you to continue to do a daily self-check of your symptoms and call in should you have any symptoms, any COVID-related symptoms, so that you can be tested at the testing site. The more people we test, the more we have control of the virus within the community. So it's really important that you call when you have any symptoms. I think that's my update for today, and I'll see you on Thursday. Good job.
Nyawa Lisa. Up next, Lloyd Phillips, Commissioner of Public Safety. Lloyd.
Well, thank you everybody for your updates today. Certainly some really important information to relate to the community. And I know a lot of the information, especially along the border issues, is very complex. And Dwayne explained a lot of the, I guess, the fundamentals of what is going to be required at Canada when you want to cross the border. And again, obviously there are precautions we got to take as a community. And what we'll be doing tomorrow is summarizing a lot of this information, and we will be putting out a communique from a task force tomorrow. Again, just to bring a little more clarity and help guide you in any decisions that you need to make. But also, if you log on to the Canada Border Service Agency, cbsa.ca, I mean, a lot of information there is there as well. But as Dwayne had mentioned, he's also available to help guide you, through that process. So look forward to more information coming out on that. Because we understand, our community has close ties to the U.S. and it's very, everybody's situation is different, and not one simple directive or one simple decision will address everything at once. So we want to be as flexible as we can, but also being as stringent and careful as we possibly can. Because as you just heard Lisa mention, we have 0 active cases in the community as we speak. Congratulations to everybody involved, ensuring that we reach that 0 number, and we'll do our darndest to keep it at 0 or as low as we possibly can, into the foreseeable future, and taking all the measures into account. Every piece plays a small part, and every community member plays a small part to ensuring that we are at that 0. As well, in Quebec as a whole, there has been 669 cases announced today, which is the lowest that has been in over 2 months. So again, some positive developments there. So from the peak in early January till now, 5 weeks or so, we have seen a significant decrease in the number of cases. Again, all pointed in the right direction. But I have to emphasize, as we said many times, now is not the time for us to relax or say, well, we have no cases in the community, so now we're safe, so I could do certain things. That's not the case at all. Because the virus can have a resurgence very quickly, as we've seen just over a little of a month ago. So remain vigilant. We have, like I said several times now, we have that vision, light at the end of the tunnel. As Lisa mentioned, the vaccines, are coming. So, we got to hang in there just a little bit longer and stay vigilant, a little bit longer as well. So, with that, I don't want to take too much time. I know it has been a long show, a lot of information. But I will like to mention, in order for us to have information given to the community, not have such a long show on Tuesdays and Thursdays, we have decided that we are going to be adding, at least for the next few weeks, an additional show on Wednesday, so that we could have more information to the community, pertinent information given to the community, but not having to sit in front of your computer or on your iPhone for 45 minutes or so. So we'll have shorter shows that will be more concise. So Starting next week, we'll have a show on Tuesday, Wednesday, and Thursday for the next several weeks. We'll play it by ear as we go. If we have to lessen the shows, we will. If we have to increase them, by all means, we'll do that as well. But I just wanted to give you a heads up on that because we're always here to ensure that we inform the community as best as we possibly can. So with that, I thank you very much, and I'll talk to you soon, and onigawahi.
Yeah, Lloyd. And just before we go, Maris Jacobs did give out her cell phone number. We just want to ensure that the number was correct on the screen. So it is 514-971-8077, and that phone number will be in the comment section of this video. And just before we go, we just want to let everybody know that there is a free workshop, and this workshop is for the Indian Day School settlements on behalf of deceased Kahnawà. It takes place tonight at 7:30 p.m. However, you must register before the meeting starts, and we'll put that website right there at the bottom of the screen, and it'll also be located in the comment section. And finally, the emergency food services for emergency food service and the Cattery food baskets are asking that people please keep your walkways and porches shoveled and salted, and this is to ensure safety for everyone when entering your home. And please note that if the delivery person sees that it's not safe to enter, there will be a delay in getting your services delivered. It's also for the safety of everybody who is coming to your home, so please ensure that you have that cleared up. Make sure your driveway is accessible, and if you have any loose dogs, please make sure that they're tied up as well. And with the added complication of this weather, there may be some delays in delivery of services. And that's it for our show today. Thank you very much for tuning in. And from all of us here, Yawagoa, Danu, Onigiwahi.